The medical aid team makes a couch call. Several recent studies on whether or not radiation from cell phones causes cancer have come up inconsistent in the findings. So how safe are they? Medical aid team reporting for duty, Dr. Manny Alvarez, Sonara Coomer, and David Smotty. Good morning to all of you.
Good morning. Top of the morning to you.
It's great to have you. Dr. Manny, you know, with the cell phones, they're ubiquitous. We all have them. Now some of them are coming out with labels warning you, we're not so sure about what's going on.
Yeah.
Are they still safe?
I think they are. You know, look, there's mixed messages altogether. Basically, the latest review didn't show any significant increase in brain cancers, which is the kind of cancer everybody's worried about. But you have to remember that brain cancers are a little slow growing. There's one specific type of cancer, gliomas, which have seemed to have been on the uprise.
What are they?
They're a very malignant type of brain cancers, and but very specific in nature. One of the things, perhaps, is not the radiation. You mentioned in the intro, radiation. No, perhaps is the heat. So in some phones, you're going to have this SAR, the specific absorption rate, which is the kind of heat that these phones sort of put out, and you may be able to choose a low emitting absorption rate type of phone if you're worried. But always remember, kids, no in case of emergencies, and try to put the doohickey in your ear and keep the phone away from your head, otherwise you're going to mess up your hair.
You heard it from the doctor. Keep the doohickey away from your head. Sonara, let's talk a little bit about something else that's in the news, and that is these CT scans. You know, rather than having a colonoscopy the traditional way, some people have these virtual colonoscopies. But I didn't realize until this new study came out, one of these things can have the same radiation as 400 chest x-rays.
That's right. And actually this is coming out because one of the doctors who's been trying to bring it to the attention of the FDA has recently been terminated. So he's saying that he's being terminated because he's been trying to blow the whistle on the fact that CT scans are emitting high doses of radiation, and we're doing them frequently. So what ends up happening, what we have been doing with CT scans is using them for diagnostic purposes. You go to the emergency room with belly pain, you get a CAT scan. Now we're using them for screening tests, and they do emit high doses.
And David, there is so much radiation involved.
Yeah, there's definitely a major increase in the numbers. If you look at 1980s, we've gone from 3 million CAT scans to now 70 millions. We've covered this in the past. You want to make sure you go to centers that they calibrate their CAT scans, they're really monitoring the patients, the technicians are doing the right thing so the patients are not getting exposed. This is what I learned from even studying this, because there's a big debate between radiologists and gastroenterologists. Endoscopy or colonoscopy is a gold standard, and there's about 6 million colonoscopies that are being done every year. The complication from that is small, perforations, bleeding, less than 2%, but it's invasive and you need sedation. So for younger guys, get colonoscopy. Older guys, because the rate of radiation, then go for virtual colonoscopy because it's easier and it's 5 minutes. If it's done in a monitor setup, it's not so bad.
All right, David, Sonara, and Manny,
Great to see you.
Thank you very much.
Thanks.
More information, go to foxnews.com/health. Coming up.